So today is National Wear Red Day. The American Heart Association's Go Red for Women movement in the fight against heart disease and stroke in women. Now, the AHA reminds us that cardiac arrest can strike anyone at any time, at any age, and CPR is vital in saving lives.
Joining us right now this morning, 3 heart attack survivors. Dina Pinelli, 48 years old. Looking good, Dina.
Thank you.
Margarita Pineiro, 43. Fabulous. Brittany Williams, 32. What the heck are you doing over here?
I don't know.
And Dr. Evelina Grayver. She is the cardiologist at Northwell Health and a volunteer for the American Heart Association. Dr. Grayver, nice to have you all here. So why do we need to get the word out? Why is it so important?
Exactly these 3 reasons. Because of the fact that, unfortunately, people forget the fact that and don't know the fact that cardiovascular disease is still the #1 killer for women. It kills more women than all cancers combined, breast cancer, lung cancer, and colon cancers. Heart disease does not discriminate. And unfortunately, we have all 3 examples here where symptoms were not typical, because women do not present with typical symptoms, right? Hollywood has done a phenomenal job where when a man clutches his chest, we know the fact that the man is having a heart attack. When a woman clutches her chest, they think that they either have an indigestion or an anxiety attack, but they never think the fact that it could be actually cardiovascular disease.
Brittany, you're young. What were the symptoms? Did you realize what was going on?
No, I had symptoms 3 days prior leading up to the cardiac arrest event. That Wednesday, I was at work, feeling great, and then suddenly the entire left side of my body went completely numb and tingly. And I knew something was wrong because I never feel like that on a day-to-day basis. So, of course, I Googled, what does it mean when the left side of your body goes numb? And 3 things came up: stroke, heart attack, cardiac arrest.
Oh, my God.
And I ran to my boss and I said, oh my gosh, this is what I'm feeling. I just researched and I'm scared that this is happening. And she's like, you're 24 years old. You run 5 miles a day. You eat extremely healthy. She said, that would never happen to you in a million years. And I trusted that because I was 24 years old. I was doing everything they tell you to do at such a young age. And 3 days later, I was on the ground in a restaurant in Times Square in cardiac arrest with no pulse for about 2.5 minutes.
Oh my goodness.
Yeah.
And did somebody do CPR for you?
Yeah, so my mom cried for help in the restaurant, and 2 ophthalmologists came to my rescue, detected I had no pulse, and began CPR, and they performed immediate CPR for 8 minutes.
Wow.
They brought my pulse back, and then the paramedics arrived on scene, placed an AED on my chest to shock my heart back into rhythm. And I was whisked away to Mount Sinai Hospital, where I was then placed in an induced coma. And waking up 2 days later, hooked up to a ventilator, realizing I didn't know what was going on. I knew by looking at my doctor and my parents that something terrible was going on. And later on, they told me I went into cardiac arrest 2 nights ago. And I was in disbelief because I was so young. I was doing everything they tell you to do to live that young, healthy lifestyle. And he diagnosed me with a genetic heart condition called long QT syndrome. So it causes chaotic heart rhythms and the electrical system. And before I flew back home to Florida, they told me I had to get an implantable pacemaker and defibrillator to prevent these episodes from happening.
Margarita, when you hear that and when I hear that, I get angry. I get angry because your boss is looking at you saying you're young. That's not the case. Did someone? It's hard for us to talk about this because, like you said, we're fine. We have anxiety. It's a panic attack. When is it where you need to cross the line and say I need to go seek some medical help for your situation?
When you know your body and you are in tune with it, you advocate, you push. No is not okay when you don't feel good, and that is exactly what I did that morning. My vitals were fine. My first EKG came fine. My third EKG and some blood work, it was a very different picture. I was having an evolving heart attack.
What is that?
So it was happening.
Okay.
It was coming and going. I had SCAD, spontaneous coronary artery dissection. So my heart attack wasn't typical. It was a tear in the lining of my artery that created a blockage and developed a hematoma that was 99% blocking 3 of my arteries.
Wow.
While in procedure, the doctor said it was collapsing, it was dissecting, and 3 stents later, he was able to keep me alive. And had I not advocated and pushed and decided that I wasn't going to self-diagnose as a busy mom, a professional, and a woman, you know, facilitator of all things, don't self-diagnose. Listen to your body and advocate.
Do you think that when women hear this, they're like, I'm being overly a hypochondriac. Every time I feel something stressed out, I'm going to go to the doctor, and I don't want to be labeled that?
No, You know yourself.
Yeah.
No, let's stop doing that.
Yeah.
So Dina, let's hear your story. What happened with you?
So if I had symptoms for 9 weeks where I thought it was anxiety, I had every excuse in the book. I was a yoga teacher, I'm a 4th grade teacher. I eat healthy, I've already lost 100 pounds, so I was doing all the right things. I knew my family history. My father had a widowmaker as well. I was on cholesterol medication. I was doing everything you could possibly do to prevent this from happening. And then it happened. So I had my first heart attack in the middle of the night. My dog actually saved my life and woke me up. And then the next heart attack was about 5 days later on my treadmill. And
So you didn't go to the doctor after the first one?
I did not.
You didn't know what it was?
I did not know what it was. I had all the symptoms that did not typically look like a heart attack.
Jeez.
So I had the pain in the chest. Yeah, I had wrist pain and elbow pain, which is something that you rarely hear about. And that to me was what, for me now, I know is my symptom. But I woke up in the middle of the night and my wrists were hurting, my elbows were hurting, my chest was hurting, my back was hurting. I was sweating, I couldn't catch my breath. I thought it was anxiety, and I thought it was the worst anxiety of my life. And I went back to sleep, unfortunately, and continued symptoms on and off until I got on that treadmill. And then I tried to do a 5K, and it did not happen. Had my next heart attack. Went to the doctor that day and sent me right to the emergency room because my EKG was abnormal, and I was still having that heart attack. And then a week later, I was walking the dog with my father around the block and didn't want to be that hypochondriac like you just said. So when the symptoms presented the third time, I ignored them and I went back to my house and acted like everything was fine. And then I called the doctor thinking something just doesn't seem right, and it wasn't right. So that was my third heart attack. I went back in, 2 stents, and luckily I'm here. But
I'm so happy all of you were here. So Dr. Grayver, what's the bottom line? Somebody's watching right now. What do they need to know?
They have to know their body. They have to listen to their body. They have to be their own greatest advocate. And unfortunately, we as women are at a bit at a disadvantage because unfortunately, you know, CPR is not performed on all women, and that is really one of the biggest.
Why is
wonderful. Because unfortunately, people feel uncomfortable performing CPR on women, whether or not it's anatomically, or maybe because of the fact that, once again, they don't think the fact they even had a cardiac arrest and they think that it was some sort of an anxiety, panic attack, or they just fainted. But this is why the American Heart Association really, especially this year, we have the challenge, right? Beat the beat, and now the CPR challenge, where we really challenge 3 of our closest people to really kind of start doing it and start learning it. And it's not hard.
It's not hard, right?
It's not hard. We can learn right now, but it's really not hard at all. And no, we no longer have to do mouth to mouth. It's hands only CPR. It is in the back of your head. All you have to do is listen to the Bee Gees song, "Staying Alive."
Right, Staying Alive.
And
just
compress.
And
just
it.
press. And just press. And just keep going up until the point that somebody is either able to get that AED for you so that they can potentially shock the patient out of that abnormal heart rhythm that caused the cardiac arrest to begin with, or the EMS gets there. But you don't stop. You hear the song in your head, you keep people alive, and you just compress.
And is there, we're looking at some video right now. Is there a certain part of the chest that you should compress on?
Yes, so you really put your hands together right that way. You put the palms of your hands really right over the sternum, and you stand over them, and just like that, when you're standing on your knees and you're pushing right exactly that way. It's rapid, it's deep, and you keep on going and staying alive. That's it.
Any other things that women can look out for in terms of like, hey, I'm thinking I'm having something abnormal, I should go see a doctor?
Absolutely. So first and foremost, put yourself first, okay? It's not selfish to actually care for yourself. And always remember the fact that most likely a woman will not have the typical chest pain. Most likely they will have either shortness of breath, they will have this weird aches and pains, and they will have exhaustion, true fatigue, which is exactly what sort of one of our patients here did have, is that just the wind completely knocked out of them.
Wow.
All right, good advice, Dr. Grayver. Thank you so much. Dina, Margarita, Brittany. So happy that you ladies are kicking you know what on this Go Red Day. Thank you. And thank you for sharing your stories. Appreciate it. Thanks, Dr. Grayver.